I just want to make sure, I know people are very passionate about the subject, but I want to make sure that we are refraining from clapping and show some support that way. Just to make sure we have a committee that can be easily run.
Thank you, Chair Avalos. I'll try to be brief because I know there's a lot of people from the community that are here to speak. I wanted to thank Chief Suhr. I also see Commander Ali, Commander Korea back there for being here. I know the Police Commission is the ultimate decision maker here, and that there's a number of forums coming up in January, so I'll be watching carefully. And I think I want to be supportive of officers having different tools to make sure that they protect the public safety, but also that their safety is protected as well. And if tasers, if data can show that it might be a good tool for officers, and that data shows that it doesn't violate civil rights, and that and we could fund adequate training for our officers and the department, I could see that it might be a good pilot project. But I guess I do have some concerns, as my colleagues have raised, of how this is moving forward. We have to listen to community input. I definitely want to understand the cost impacts also of a fully implemented taser system from a pilot program as opposed to a broader level, the training costs and the effectiveness as well. And I just also wanted to say that I'm hoping that we can talk through as thoroughly as possible the civil rights implications, not just of the Interstelli case, but also in the Richmond district. In the inner Richmond last year, there was a death and a mental illness issue, and I'm trying to understand how our officers are, with the crisis intervention team, are as adequately trained as possible to deal with whether it's immigrant and non-English speaking populations or African American community issues, as in the Stelli case, and other issues very, very sensitively. But I share a lot of concerns that have been raised by the ACLU, the Asian Law Caucus, and many of the community-based groups that are here, and the comments of my colleagues as well. But thanks for being here. I'll be watching carefully the January community meetings as well, that the Police Commission will be holding as well.
Thank you. I will very quickly, the case you cited in Richmond, that particular person in crisis murdered his mother with knives and then popped out and turned the knives on the officers. They did deploy what the current less lethal option that we have. It was ineffective, and he continued his assault, having already committed what ended up being a murder. Those are, again, tragedies to be sure. I can assure you that the crisis intervention training is a priority for me. It is a priority for the department. It is ongoing. It is robust. We have tremendous support from the mental health community in going forward on it. And the discussion is in process about the taser. So that's being discussed. The crisis intervention training has been, will continue, and it would be my desire at some point in time to have the entire department have that additional level of training. Thank you.
Just before you go, real quick, do you have any thoughts about the Memphis model of crisis intervention? I've heard a lot about it recently. It's been around for a long time, since 1988. When I read a statistic, I think it was cited by the University of Florida, I believe, that there were about 2 to 3 shootings by police officers a year, and then that was reduced actually from 88 to about 2011 to about 3 in that whole time because of the strategies that were employed in Memphis around crisis intervention. What are your thoughts about that and how that would be?
Well, first, in the last 2 years, we had 1. So we're doing well in that regard. The officers have the message. I spoke to the chief of Memphis at the recent International Association of Chiefs of Police Day meeting. We actually have more crisis intervention trained officers than Memphis does by ratio. And unfortunately, they had just had an occasion where they had to use deadly force on a person in crisis. They also don't have tasers, but he said he would like to entertain something like we're discussing here, but for budgetary constraints. But no, the Memphis model is a good model. I actually believe that ours is almost the Memphis model plus.
Great. Okay, we'll be going to that with the commanders. But I really appreciate you being here, and see you soon.